All right, good morning, everybody. I'm Senior Sergeant Haas with the County Paramedics. Thank you very much for taking time out of your day to come for this rollout. So we've got a really exciting initiative that is going live officially today. And I would like to first start by introducing Captain Kelly Starleach. She's going to go ahead and kick us off.
Thank you, Abby. Is this on? Can you hear me? Okay. Yeah, okay. All right. Well, yeah, thank you, everyone, for being here today. And I just want to go over who is sitting on the panel here, because at the end, we'll be able to take some questions if need be. And to my right, I've got Director of Laboratories from the Blood Bank of Delmarva, Kristen Frederick, County Executive Matt Meyer, Director of Public Safety Vaughn Bond, and County Medical Director Justin Eisenman. So, what a better way to celebrate the theme of this year's EMS Week, which is where emergency care begins, than by putting a cutting-edge, life-saving tool in the hands of our paramedics. This is an important and exciting time for Newcastle County EMS. We're here to announce the launch of a groundbreaking project. Paramedics will be carrying whole blood for transfusion in the field. In doing this, Newcastle County is taking a big step towards reducing morbidity or mortality and towards saving lives after traumatic emergencies. Trauma is the leading cause of death in people under age 45. Our paramedics have traditionally used methods to stop the bleeding, such as tourniquets, hemostatic agents, and medicines like TXA. But while we were trained to stop the bleeding, our limited resources didn't allow us to adequately replace the blood that was lost. And studies show that by providing early blood in the injury process, it greatly increases the outcomes and life expectancy. Minutes truly count. And when you're faced with a life and death situation on the street, every minute is critical. Whether it's a car or motorcycle crash, or a victim of violent crimes such as a shooting or a stabbing, or any other trauma that causes serious blood loss, whole blood will replace what has been lost from bleeding, something that traditionally wasn't possible in the pre-hospital setting. With the ability of our paramedics to administer a whole blood transfusion in the field and in the back of an ambulance before the paramedic even reaches the hospital, lives will be saved. There's over 150,000 deaths due to injury in the U.S. every year, and 20% of those are preventable, or 20% of the preventable deaths are due to hemorrhagic shock. Looking at our data from 2022, nearly 100 patients in Newcastle County could have potentially benefited from whole blood administration. While statistics show that the whole blood is needed in all areas of Newcastle County, the concentration of its use will be within marginalized populations. All victims of trauma, and in particular victims of violent crimes who are at greater risk of being in shock from blood loss, will benefit from the care just minutes after they're injured. This initiative really has been a long time coming. The idea of pre-hospital blood transfusions was born out of a Delaware statewide trauma system of care meeting more than 5 years ago. And they had a presentation, and it was citing success out of military and aeromedical pre-hospital agencies. But the equipment for ground EMS did not support the highly regulated cold blood storage that is needed. The plan just basically hit a roadblock at that time. But with the advancements in equipment and technology, over time it became possible. And remember, this is only being done in a very small number of high-performing agencies across the country. We heard about the San Antonio region in Texas that was doing this, so we collaborated with them, and they consulted with us and helped us out figuring out a path moving forward. And if you've ever heard the saying, it takes a village, well, no truer words were spoken, because any groundbreaking initiative like this takes a collaborative partnership across several different agencies. But first and foremost, I want to thank my colleagues, Lieutenant Aber, Lieutenant Nichols, for all their hard work on this project. I'd also like to thank Chief Mark Logeman, who has really championed this cause with unwavering support from the very beginning. And unfortunately, he couldn't be here today. I'd also like to thank Director Bond for supporting us, and of course the county executive, Matt Meyer, who will have some words a little bit later. We really do have a great team here in Newcastle County. So a couple of years ago, we teamed up with Sussex County EMS, who was working on a similar project, and we worked together to find ways to support this initiative and improve the care of our trauma patients within our entire state. We're so proud of our partnership with Sussex County EMS, and we're happy to say they also went live with whole blood just yesterday. Our county medical directors, Dr. Eisenman, who you'll see down here, and Dr. Birch, we worked very closely with us to bring this initiative to fruition, and they were key in developing the protocol needed for blood administration. We have to thank the State Office of EMS and our State Medical Director, Dr. Rob Rosenbaum, who supported the pilot program and guided us, both us and Sussex County, along the way. The partnership that we forged with the Blood Bank of Delmarva is truly unprecedented in their region. We've worked diligently with our area trauma centers, and we've also gained the support and funding through County Council and, of course, our County Executive, Matt Meyer, which it didn't take much there. All we said was, this is going to save lives, and he just said, how much do you need? There was a lot of work that went into making this happen. It's very exciting to see this thing being launched. The Newcastle County Paramedics are committed to staying on the cutting edge of pre-hospital care, and this whole blood program is going to make such a huge impact on so many lives, and quite frankly, it's changing trauma care in Newcastle County. We are fortunate here within the state to be a part of such a high-performing system. I would be remiss to say that without the hard work and dedication to their patients that our paramedics have, that any of this would be possible. We have such a strong and solid workforce whose knowledge, skills, and abilities I'll put up against any other agencies in the country, really. In addition to our regular continuing education, all of our paramedics have undergone rigorous training specific to this initiative, learning more about pathophysiology of shock due to bleeding, and they've also undergone hands-on training in the use of specialized equipment needed for blood transfusion. And we'll give a little demonstration afterwards, but we are ready. We hope we never need it, but we are prepared for when the time comes that someone needs this critical life-saving blood. I look forward to answering any questions that you might have, but we have someone who'd like to say a few words. None of this would have been possible without the partnership that's been formed with the Blood Bank of Delmarva. We literally were in uncharted territory. And it was such a great experience working with the entire team at the Blood Bank of Delmarva. I don't know what I'm going to do on my Wednesdays at 11:30 anymore. I'd like to introduce you to a big part of that team, Director of Laboratories, Blood Bank of Delmarva, Kristen Frederick.
Thank you, Captain Starleach. Good morning, everyone. My name is Kristen Frederick. I'm the Director of Laboratories for the Blood Bank of Delmarva. We would like to thank Newcastle County Executive Matt Meyer and Newcastle County Paramedics Chief Mark Logeman, please pass that along to him, and their staff for inviting us here today. It is certainly an honor to be here and share in this good news. On behalf of our President and CEO, Dr. Christopher Hillier, as well as Vice President Emily Cunningham, we thank you for this opportunity. Here with me today is also our Communications Specialist, Tony Prado, and as promised, he's wearing his Newcastle County pin for this event. So we have been working very closely with Newcastle County Paramedics and the state of Delaware to establish the pre-hospital whole blood program. We have focused a great deal of time to make sure this program is implemented safely and effectively. Because of those efforts, Newcastle County is now able to carry this life-saving resources on their supervisor vehicles, and we have 2 units deployed right now as we stand here. The paramedics will be using low-titer type O positive whole blood supplied by the Blood Bank of Delmarva. This specific product allows for safe transfusion to any patient regardless of blood type. In a trauma situation, replacing blood loss directly with whole blood rather than other fluids will not only replace that volume lost, but will also increase the oxygen carrying capacity and promote clotting. There's increasing evidence that pre-hospital whole blood transfusion will support better patient outcomes overall. However, saving lives through this process is only possible with the continued generosity of our blood donors. This is a powerful gift where donors are able to give back to the community and really make a difference in the lives of others. But we cannot wait for traumatic events to occur to motivate our community to donate blood. It is the blood that's already out in the field that is going to be available for use in emergencies and save lives. According to America's Blood Centers, 62% of the U.S. population is eligible to donate blood. However, only 3% actually donate. Now, I know we can do better than that. So in order for this initiative to be truly successful, we need the continued support of our community in the form of blood donations to support this life-saving program. So in closing, I'm encouraging everyone to step up and do something bold this summer by donating blood to support our community and our county paramedics in this life-saving initiative. Thank you.
Thank you, Kristen. Before I turn things over to the county executive, we'll take any questions that you might have about the blood project. Any questions that anyone has?
How much does it cost?
You tell me, sir. You wrote the check. The initial, you want to take that, Director? The initial investment?
Yeah, the initial cost was $18,500. And we anticipate or estimate that it's going to run us roughly about $50,000 to $60,000 per year to carry on this program. Understanding that a life is worth a lot more than $50,000, so that's peanuts. It doesn't even factor in. This program, I wasn't going to say anything, but this program is just an evolution. It's an evolution of what the paramedics are doing. They're constantly out here educating the public, they're treating the public, and most importantly, they're saving those individuals who are in potential life-threatening positions. So this is outstanding, and the cost really doesn't matter because the county executive said he has it.
Thank you. Any other questions? Okay.
I think there's
Yeah.
one in back.
Yes.
I got a couple questions. How is it stored? How long before it expires, et cetera?
So the expiration date on whole blood, low titer O positive whole blood is 21 days. And it's stored in which we'll show you a Credo cooler over there, which has tick panels that keeps it between 1 and 6 degrees Celsius at all times. And in fact, Kristen and I were just looking at it. We can look at the temperature and monitor it remotely with the technology that's in there called a temp stick. So we can bring up a dashboard and actually see what the temperature of the blood cooler is at any given time. And we can look at the historical data. It will also send us alerts if the temperature is going out of range or getting close to the end of range. We validated that cooler to hold temperature for over 100 hours. However, we'll be changing the tick panels every 24 hours, so we've got a huge safety net there.
How much is available at any given time?
On-
Any given day?
In Newcastle County, we will be carrying 2 units of whole blood in the field, and that's going to be on the sergeant trucks. And the sergeants they're assigned into the northern sector and the southern sector, although they can go anywhere within the county that is needed.
Is there any plans to expand that?
Yeah, this is, the question was, are there any plans to expand this? And this is a pilot program, so right now, we're just using this for trauma patients that are exhibiting signs of hemorrhagic shock that are 15 years or greater. There's plans to expand that in the future, and it could be, younger ages, it could be, expanded into medical patients because there's some need there as well. So that will be after the success of this pilot program, which we're pretty confident in. Yes?
When something implemented this or announced it, one of the main issues is that it can take up to 30 minutes to get to a hospital in some of the rural areas. Is that an issue in Castle County as well?
Well, regardless, the earlier you get a unit of whole blood to replace blood that's been lost, the sooner you do that, the better outcomes there are for patients. And there are places in Newcastle County that takes 25 minutes, 30 minutes to get to the level 1 trauma center. And also, if it's a child that's 15 or greater, they could also be going to DuPont, and the travel times there could be a little bit longer. Great questions. Any other questions that anyone has?
What made you decide the age of 15 or older?
Because our protocols consider age 15 and older adult.
And you guys will be available after?
Oh, yeah, we'll be available afterwards to take any questions that you might have. Anything that anybody wants to add there? Good? All right. Without the support of your leadership, not much moves forward at all. And we are very fortunate in Newcastle County to have a county executive with a focus on improving lives of the people in our area and who supports the mission of Newcastle County EMS. I'd like to invite our county executive, Matt Meyer, to say a few words.
Thank you. Yesterday, I was at a fire service event, and a paramedic with 3 decades of service just came up to me, and he said, "Tomorrow, what you're announcing is really important." And I said, "Oh, you think I'm now announcing that I'm not going to run for re-election? Like, what could it be?" And he said, "No, seriously." He said, "What you're announcing tomorrow is the most consequential thing to happen in trauma care for paramedics in the 3 decades that he has served as a paramedic." We have an epidemic of gun violence in our community. This is not a cure to the epidemic of gun violence. We quite frankly have an epidemic of vehicle collisions, of pedestrian and cyclist deaths that's unacceptable in 2023. This is not a solution to those problems, but it is vitally important to increasing survivability in both of these problems that disproportionately impact the least among us. And so when Chief Logeman and Captain Starleach and the leadership of the paramedics along with Director Bond came to me and said, there's this program for whole blood, they're doing it in Houston, it would save lives, but it's really expensive. I said, "How much?" And they said $18,000 to start and $50 to $60 a year to continue it. It's a no-brainer for us to save money. To save lives, to invest money. When you think about what these heroes in uniform do every day, there's nothing more important. There's nothing more important than equipping them with the tools so that they can save lives. It's also something for us. There are constantly new technologies arising in public safety, and we need to be the first to adopt them. The quicker we are to adopt them, the more people who may not wake up tomorrow morning will be able to wake up. I see Teresa Monta-Murphy here from the Delaware Coalition Against Gun Violence. Sarah Stowens here representing Christiana Care, Stop the Bleed, Moms Demand Action, and of course, Blood Bank of Delmarva, along with Christiana Care and Doctors for Emergency Services. Thank you, Dr. Eisman, for your incredible support. It took a lot of leadership among the medical services team at Public Health, Dr. Rosenbaum and Dr. Eisman, to make this happen as well. Ultimately, when push comes to shove, this is not a decision about money. It's about paramedics who could just do their jobs every day. I think we all know the reputation, the negative reputation that a lot of people have about public employees. It is not accurate, and it's certainly not accurate when it comes to our paramedics. They recognized a technology that was out there that's able to save lives, that's able to impact outcomes of what they do and what you do every single day. And so we owe a debt of gratitude to each and every one of you for not only what you do every day, but for constantly looking for the little slightest advantage to enable the least among us to survive and live till tomorrow. So thank you so much, those who are here, for your tremendous support, and as Kristen said, this only works if people get out this summer and give blood. I should add, because Tracy Monza Murphy told me to add it, it takes according to Transfusion Journal, victims of gun violence generally need 10 times the volume of blood, the amount of blood, as individuals in other trauma incidents, car accidents, falls, and things of that sort. The cost of this program for gun violence victims is approximately $12,000 per incident, as opposed to $6,000 for falls, car accidents. All those numbers are, I believe, from the Transfusion Journal. And so it's important that I say that, because I want people in the community to understand the tremendous cost, not just in terms of human life lost and the trauma to families, but there's an actual direct economic cost to gun violence in our community. Thank you so much. Really appreciate the leadership shown by so many within and outside of county government.
Thank you very much, County Executive Meyer.